Me mamu akwaba eba health matters dwumadie so aha ye bia ye twetwe apomuden ho nkomo na ye hudi a ebeboa ya apomuden and then so ye wa ha say ye bedi yare bia ye friend say gonorrhea but it is gonorrhea in men any who discussions na ye be ye ende said the ade bia ye ne dada no ye ne doctors akukudam ene ba dwumadie so ebe twetwe nkomo enti ka me ho na ye nkohia Dr. Grant Yama wakaba doctor eba health matters dwumadie so now say you are looking beautifully handsomely today.
Thank you.
Okay, doctor, and then yarea yedeba yedwumadie so no yesi gonorrhea in men. Minim say gonorrhea no say na ye wo men any women there wo but and then me who say ye wo gonorrhea in men. So again ma gonorrhea in men different from the normal gonorrhea we know. Asa na doctor di ni nchechiremu ebeba no ye wo aboafo bi a waso yensa ama yetimi di dwumadie yi ebrew ye sponsors Eden Block Factory eho pe block papa cement atinu blocks a edimu blocks a wo di sidan a content wo be realize kra na chese edan wasi ewie nti se wo pe blocks papa wo di sidan a embubu ehun rere enkoye basabasa de a and therefore we need Eden Block Factory ewo obidan kwan so na from so ewo ahomatrofo so 0535 961 807 and I say 0243 964 264 na sa wo pentarian so a edimu quality efri amanone ebi so free ya man mu ha dia and the man hwe baby a for any Fly Trends Collection awo Wiliba Junction na sa wo ntimi so enko ho ubetimi afro mo so wa homatrufo yi so 0278 964820 na wakwaje wontare a edimu medase na afa so de besan atwa yani akọ doctor so ama doctor ene ya twetwe nkomo enti doctor ya kwaba ya sama wakwaba biom na ya pese ye hu say what is gonorrhea in men because we all know of gonorrhea but na ye nim say ye wo gonorrhea in men ewo ho so what exactly is gonorrhea in men
medase gonorrhea is one of the STIs. I say, Yaremu, Yare, Indem, the friend say, Indemu Yare. And it can, since a year Indemu Yare, it can affect Emba, any Emba. But I know we want to be specific on what happens when men get gonorrhea. The gonorrhea, Sanya, last year, boss say STIs. And I say STDs, no, sexually transmitted infections. And I say sexually transmitted diseases. Some are caused by bacteria, some are caused by virus, some are caused by fungi, some are caused by yeast. Into gonorrhea, one of the STIs is caused by bacteria. And bacteria causes gonorrhea, no. Bacteria, the friend Neisseria gonorrhea. Neisseria gonorrhea. And it may affect emba and embema. Into beside gonorrhea no near one of the causative factors near bacteria. It may affect emba, essentially it may affect embema. But I will delve more into emema. Gonorrhea no to be say
okay yeah that's a doctor wo ntremu a wo de amaye hu say gonorrhea endemu yare which is broni beka say sexually transmitted disease inti doctor na se miti ase ye a se mini obi nkoda ya mintimi nya gonorrhea
no the case mu no de gonorrhea is one of the is an STI
okay
that you get it inti when you know then so between you see other sources you do how you can answer what you say but it's one of it's STI
Thank you very much, Doctor, for the explanation. And the doctor, your next question I ever say Busani said, again, a course, one my yati say, a boy be a friend in Neisseria gonorrhea, and I'm meeting on Neisseria gonorrhea, sorry, and no, of course, say gonorrhea, or no, the yari any ba. But say, I wanted your ordinary baby. Me nkɔfa no bɛka me ho a menyaayɛ. So how do we get into contact with that organism, that bacteria ɛma yɛnya saa yareɛ no?
Nti sɛ na wokae the bacteria is there, so you can get it from an infected person. Nti sɛ obi a yareɛ no bi wɔ ne ho dada anaasɛ woanya gonorrhea no bi dada no we have unprotected sex a wobɛtumi anya, so there will be that transfer. Obi a woanya bi dada no anaasɛ woanya gonorrhea no bi no wondi nhyiamu wɔ ndam anaasɛ mpɛm agorɔ or sex a unprotected. So the word is unprotected. That's what I say. Wobɛnya saa bacteria no ma na ba wo system no mu. And the same thing na people who are sometimes obi wɔ no ma ɔsɛ bi a mekɔ use obi WC anaasɛ mekɔ obi ne washroom anaasɛ bi a mekɔ dwonso ɛ mekɔ bathhouse bi a me use yɛ anaasɛ toilet paper as bi a me use yɛ. You see ebi a obi yɛ infected wɔ that area amu na mu use common washroom anaasɛ mu use common way. The more maybe use no, the person might deposit the bacteria through urine and answer with discharges via until who have a contact with it, it can also be there. It's not say a STI, but bacteria no akọ baby. Now also a few on. But I don't make what I say. Until this bacteria will be there, but the moment it comes into contact with your system, neutral area. So last year can I say yare bi won ma bacteria no baby or beneficial but oba the way to be say these are the ways when we have unprotected sex with an infected person. So that is the way with an infected person. So if the person is not infected, you're not going to get it. What I say, but with an infected person unprotected, you can get the gonorrhea.
Thank you very much, Doctor. But Doctor, I mean, one concern question here I want to ask. Almost all the time they are talking about unprotected sex and then having protected sex. But I think that sex, no, a lot goes into having sex with someone. You can say even some people go the extreme of having oral sex. But protection, it comes only with condom. That is the female or the male condom. So what about the kissing, the exchanging fluid and all of that? What about that?
I think a good question. As I said, we don't have oral protective tool or so mostly what you can do is the same condom. So
if you want to lick your woman, there are some guys that they really eat pussy. So if you want to lick your woman, you can't put condom in your mouth to lick your woman. No. You're definitely going to do that with just your
then you have to check and cross-check that your woman is clean.
You know?
Oh, you know, for cleanliness, like for when it comes to what do you call it, infection and stuff. I mean, sometimes you have to check for you to eat pussy or lick there as a man. Just be very careful.
Very careful.
Because as at now, there hardly be any form of protective mechanism. Because about it show in the room. I say, maybe all shape protected. So no,
they are sucking dick.
They are sucking dick. And I say, oh, call it, or call it condom. Now I say no. So I say female condom. Are you going to make it's not possible. That's why I'm saying I have to be very careful when I'm trying those means of sexual arousal and other way. But some of them, I think, say we try to say those who do the oral sex now, they know. I try to make sure that if it's condom, which the person has changed condom. That's one thing I can change condom. And he said, yeah, you had oral sex still with a condom. The guy was on condom, or the condom was on. No more having oral sex. Weaving on with the condom on. You get it?
You can.
Oh, you can't lick the condom.
How can I lick a condom?
No, the condom is.
It's your skin I want to feel.
And if you want to fool, if the skin that you want to fool, why is that when the person is sexing you vaginally, That one there. What you are not saying that you are
Do you know
always
that most of our youth, we use condom not protecting STIs
no,
or
no, no, no,
whatever.
no, no,
We
no.
use it for
pregnancy.
unwanted
Yeah.
pregnancy.
So that's why we are doing this education. The protective mechanism we are doing is not only for pregnancy.
Yeah.
Most especially in Kenya, 80% is for the diseases.
Okay.
But as you said, you earlier said no. We rather use it for pregnancy. If not pregnancy, we don't. So in the case of oral, if you've been able to use the feeling and kobenya vaginally, no, but when you cry, when you use condom, no, so orally you can use a condom too. But that's right. If you don't get the condom, the reason I'm talking about all these things, like fine, any practical things I'm talking about, is like some people have even anal sex.
Yeah.
And the anal sex, you finish the same condom that maybe you use for the anal. I try to say that you're going to use the same condom to enter the vagina. So you have to change. You get it? If not, you are going to transfer an organism from a place to an unwanted
from
place.
the anus to the vagina.
Or from the oral cavity to the vagina.
Yeah,
You get
I think
it?
that's alkaline and then
Very good. Acidity level that we always talk about. So try as much as possible to do the protected and non-protected I'm talking about. Be sure and double sure before you do you practice certain acts. You get it? But when it comes to STI, it's protection that we're talking about.
Okay.
The person can be on family planning, but is still not protected. So if you are preventing pregnancy, that one family planning is secured. But then what about the STIs? That's why we talk about protected sex and unprotected sex. We get it. So that is it.
All right, thank you very much. We really appreciate this explanation. I think it's worth it. Okay, doctor, I say you be free courses so aqua. Samenya gonorrhea. I am feeling uncomfortable. What are the signs and symptoms? Me who say like me who namu enya me fine. Me cause me copia, my urine is not okay for me. What will make me know says that the way your gonorrhea and menya and I said them because most of the times we the young ladies, though we are not talking about women, but I just want to bring this in between. We the young ladies no say you feel uneasiness via your vagina area when you see your white. So forgetting about the women for now, we bring that later. And then a bema be who say we a gonorrhea and a menyano because there are a lot of diseases that may be any gonorrhea and the same symptoms. So what are the signs and symptoms there? In your ma a bed actions so dear bema me who say a gonorrhea and a menya.
Okay. Gonorrhea signs and symptoms it depended on the location of the gonorrhea. We'll talk about that one. Yeah.
Okay, let me interrupt. So studying location it means that gonorrhea no and yet sex organ in one affected.
Right. Have another topic on that. We'll talk about it.
Oh,
you get
doctor,
it?
I would like you to give us one.
Do you know that candidiasis? We have oral candidiasis.
Yeah, I think I've heard of that.
Yes. That's why I said I have another video on the locations of the gonorrhea. But the reason I'm talking about it, this is gonorrhea. No, it's me. A cause and I say a bar. It's me, ma. Obi one man prostate.
Okay.
What I say. Into this signs and symptoms, no. Obi a gonorrhea no affecting the prostate glands, no, will exhibit some signs and symptoms.
Okay.
Differently from Obi a the epididymis, which is the scrotum, no, and the testicles now. So there are a bacteria. So where it finds itself in your reproductive system, no, never cause some problem. Some find themselves in the urethra. What I say? She said, bad a lot of time you can't say UTI. The bacteria will be there. It will cause UTI. When it gets to the prostate, it will cause another problem. Do you remember what we talked about there? Yeah. With this one, it depends. Science depending where the abuano occur. But generally, and it also depends on the immune system of the person, the individual we are talking about. Okay. In men, there are some general signs that you will see. And the most way we presume or we assume say gonorrhea. Number one, discharge from the penis or what else who say in so my friend is saying take one. If you but also in so me discharge it in a cloud. I begin to say sperm. But you yourself you say it's not sperm. This one is not sperm. How can you be there and not sperms ever? No. Sperms are released when something is triggered.
Okay.
So sperms don't. It is not a matter which one sperms are. Anything that's coming without triggering. Hey, one of these things I'm talking about, a cloudy, thick, or bloody. That's one of the symptoms. And mostly, before it even reach that stage, now, it's here, sometimes you don't see the signs and symptoms. Gonorrhea no one check. But in man, because of maybe I am with Johnson and any different things, but Bema no, Johnson beba, it's sometimes to wash some away, and before the bus is there, you so quite a banner. Because the lady will feel it at a different part from where she is urinating. I hope you get it.
Yeah.
But in yen Bema no, yen because one place now you reach now, now you Johnson, and also now, the beer before I beat you feel it. And so you will not feel it early. To be feeling na it's a very discharge part na a problem of concern. Then number two, burning sensation while urinating.
Okay.
What I say, we go say, we do just every stage or you say, it's no. My family is and then when you wish, or you say it's no. It's sad for we will say, or you say na it's no. What I say, it's only a burning sensation. And number three, we have painful or swelling testicles.
Okay.
Nti wo say ne show aba na edem no ehono.
Wow.
Say inflammation and say infection the inflammation ba swelling. You get inflammation ehono. Nti abo bi aba no be cause problem. One of the areas and I say ade visible be say inflammation. Nti be hono. Nti testicle no na say involved obetumi so go say ne show ahono. All of a sudden the show aba na edem na ayi ahono. And see one of the signs are you who they are anal erection. Who was about to say the true wearing ekekano. It depends on the area.
Doctor, where the mincha one no ha. I don't know be ton draw say o anal ichia. Not just a pile.
Oh, so because say pal it me ye one now
all need to learn a lot.
and it's in the pediatric account because the same bacteria can infect your anal area with true one. Instead, bacteria this gonorrhea come say affect your anal area when you're bleeding.
Oh, I see.
So that's why we are saying that self-medication is very bad. You are treating gonorrhea, you are treating PAL. Because these examples are able to say anal itching, bleeding, or discharge from your anus. Pals, bloody, so you are mistaking PAL for a friend is saying gonorrhea. What I say? If this gonorrhea they are affecting anus now, ubenya the itching, no, ubenya the bleeding, no, now there, and now let us know painful prostate. So when if it affects the prostate gland, so bacteria can attack prostate gland now. Most so I was there because a discharge in the air. Into this discharge, maybe if you prostate gland the moon ever. What you say? It start take blood with the no. It's not always if you will cut him and say penis never no. If and if so it is connected to something. It can be connected to your kidney. It can be connected to your testicles. It can be connected to your urethra. It can be connected to your prostate gland now there. But you know what I say. So anything coming out of your penis, I had blood there. It should be of concern. Into the extra areas are able to have it. Prostate gland able to answer. I inflamed. Now and also one of the amount clues say which are gonorrhea, a bacteria infection, which are gonorrhea. And normally, since it's an infection, you can have fever. Who say one on why she was an infection. What I say, which means chills, or which means table so. What I say, and if you cry, then to some level, not I did start on skin on rashes, be that you skin on na ɛkeka ɔmo nsawansawa bebree ɛno nso yɛ one of so wobisa the signs and symptoms a ɛbɛhu ɛwɔ gonorrhea in men ɛwɔ mmarima one kakra a mɛtumi aka no ɛdi nkan ɛyɛ discharges. Number two, burning sensation, pulse urinating. Number three, painful or swollen testicles. ne hwɛ ano etumi ɛyɛ dɛn ɛho no ɛna ɛtɔ so mmienu no otumi nya fever obi nso tumi nya prostate gland infection what I say to be sad these are the things but to add to it before ɛbɛyɛ ɛbɛhu saa de wei na diagnosis obi si dɛn de wɔn sɛ ade wei sɛdeɛ wɔde ba hospital anaasɛ woyɛ wei a ɛhu sɛ nea abɔ so nyinaa tumi ɛyɛ yareɛ foforɔ ebetumi ayɛ it can be a different disease instead of you thinking say ɛyɛ gonorrhea it can also be a problem of another a signs and symptoms of another problem so we have to go through the diagnosis rule out say ampa ade wei ɛnyɛ wei ɛnyɛ wei yɛyiyi nea yɛde yɛ adwene bu sɛ ɛyɛ ɛno nyinaa film nti diagnosis no what we do in this one say we will do a urine test yɛbɛgye ojo nsɔ yɛda fa mfiri ayɛ test na running test yɛhu sɛ ampa ɛyɛ gonorrhea yɛhu sɛ Neisseria gonorrhea no ɛno na ɛwom a causes this problem ana yɛ treat sɛ ɛnyɛ ɛno a yɛde adwa akɔ ade foforɔ so ɛna number 2 yɛ swabbing the affected area nti bi ɔno ma yɛtumi de ɔmo fa sɛ discharge ne kakra anaasɛ na ɔmo de akɔ lab na ɔmo aguro ɔmo ma no nyini ɔmo tumi fa wo nsuo no na ɔmo de esi hɔ bɛyɛ 3 days 7 days na saa culture yɛfrɛ no culture like aboa no yɛnyini no yɛma no favourable environment to grow into grower to some level a na yɛde eduro aroma no na yɛhu sɛ okay wei etumi eduro wei etumi eduro ɛno sɛ ɛba so nti you do the swabbing cultural sensitivity na yɛhu aboa ban a ɛkɔ so saa na number 2 so yɛ urine test no na yɛ wei.
Thank you so much, Doctor. This sounds so pathetic. Miracle, kakra, ama me nuanom bema no because looking at the signs and symptoms, no, otimu say, enya yare a ese yedidi abro. You see, sometimes obi ka say menya gonorrhea. Now wakoto eduro bi akeke na wanom makoti gono and then you see men making fun of it but looking and listening to the signs and symptoms no it isn't something that we should make fun of it so I will urge you say we oba na wo hwe bia wo adamfo bema wo nua bema I would urge you to let him know this. Manintie na onhu say we don't joke with gonorrhea. Thank you, Doctor. Yeda was a pa. Na sir, Doctor, you are going through all these processes. You will say this is what is disturbing us. Treatment ben and I bet me ama ya okay if we gonorrhea ne ho.
So the American treatment it depending on the individual and the severity that we are talking about. But since I have bacteria, we deal with antibiotics. Okay. And this one I always say prescribed antibiotics. The word is prescribed antibiotics. And it's very important I said in doing the amount you complete it. Okay. In our other videos, as episodes, there is something we call resistant gonorrhea. The reason I make us ask him where I say some people you give them the treatment of 2-3 days. Also, we want to read with
most symptoms now. It even happens in malaria.
Yes, malaria in general, that's what people do. That's what people do. Or for 2-3 days, no jai. No more talk, no jai. So in treatment of gonorrhea, now we are talking about in men. What you are saying is make sure that you take a prescribed antibiotics, and before you take the antibiotics then you have gone through the diagnosis no make you say ampa aye aboa we na e cause side way nti edru say the man no nie so one I prescribe antibiotics and number 2 is make sure that you take the full course na the amount so that be obewie obekumkum mboa no kra so you I wouldn't say sit in the home or in your own house and buy drugs that you like no make sure that when you lab I confirm say gonorrhea, then we give a prescribed treatment, not a 2 as what is it?
Thank you, Doctor. Yeda was a power in Tremua or day amaye. And there one my yatin yoma bebrea say health matters sapomudin jumedie so and when ya papa say I was say obia etimi eshabi na when to me and share when you be to me and share. Would you share link no emma na ontimi educating ho because this sounds so sad. The reality of it is very sad for you to see a brother going through all these stuff. And to doctor, Say yentimi enya treatment and treat ye ho. Yentimi anko hospital ama yenya ndra complications ben na ye betimi enya.
Complications there say dey be. Well, actually, I was here. Complications, no. So I can be medical doctor say a infection of etima osua testicles need me then one anamebwa. It's a baby inflammation of the epididymis and say testicles. Into when treat ya now say huna say about affect into which mean inflammation of the testicles. As I suppose we show abano ya aswa na just me years the uterus structure it me if be uterus structure e ma baby a wodun so efa mu no e moa nti dun so ne ba be ya we ya
tanu na e cause
pain in urine no
okay
what I say nti e moa say e mu bie na dun so na e efa mu no na bacteria no ba na infection ba won say amoa na aye kete na so pipe no ya kete a say so be from so pressure na ma pain na eba and there will be there become inflammation of the prostate gland prostatitis and won say bacteria no so can affect prostate now it is causing the inflammation of the prostate here come
okay doctor me chawa no wa ha so we there ye me amadwen na me dey bisa question can it be possible say prolonged play in prostate cancer
say I don't know why when treat it is in your lifetime say prostate bacteria na affect the prostate gland na we treat it was say no asaba was say but say it has become inflamed ahono nti ahono na nti you see prostate can anya bibia that when prostate no ho na nti say but gonorrhea so can affect prostate no swell as say prostate so you directly gotten prostate I hope you get it nti anya yare hu anya you get prostate na be bisa ade bi na cause no this some of these things naturally yes if the huge problems yes continuous infection of the prostate gland by bacteria they will cause prostate to inflame and until if you don't treat it complications will be there was now last summit with the account here it's more risk of HIV transmissions
wow
say there be bacteria no
I am shocked
and so you become prone the moment the area abra aye infected no na yare aba ho no are available we be kwan for any infection say because you become prone you are at risk of getting other diseases what you say nti one of the things the complications na do stage now when treat all these signs can exhibit answer be show wonipadua.
Thank you, doctor. Thank you. And then like I am so sad.
Don't be sad.
Doctor, I'm really, really sad because you see, gonorrhea is the Arabia. Like we just talk about it, especially men. No, hey, Charlie Makoti gono. Like they just call their friends and then Charlie Makoti gono. Then they just random drugs. They get them, and you see them the next day they are strong going. This is so sad. So me nuanom be ma mesra mo say bibi enko so yie e wo sex organ ni mu a you should actually go to the hospital. Don't just take any random drug. And I mesra mo I know this is not possible, but mesra mo at least stick to one woman. Sure, men. I know this is really tough. I don't know why men of today, I say like Sunny girl.
Kasa Sam.
Doctor Sam, but as a majority of you men, no.
So definitely there's majority and minority.
They have
not
like
all.
Okay, Sam, they have multiple partners. Even though be find him say me girl no or someone another guy, but me bobia like me bobia na wakotiti yare bia ebe bro nyoma bebre. Please, I am begging you. I am begging you. You see, health is really, really expensive. It is really expensive, but it's cheap. It's cheap because when you take good care of yourself, you're going to live healthy. Mr. Mo. And see, I don't even know the next question to ask our doctor. But doctor, I think we will move to the prevention because some complications need there. We don't want to go through all this stress. And to preventing from getting this gonorrhea.
James said, well, that's why advocate I'm on things that will prevent. One of the things that we can do is being in a monogamous relationship. Never try to stick it to one partner. The ladies should stick to so this thing. So the man will be there.
You see, you hardly see a woman cheating.
You let's talk about both sides. You are taking side as a woman.
Oh,
so
no,
let me be general.
I know
yes, I know. You know the percentage is not balanced.
Yeah.
So let's each of us stick to one person
Yeah.
in a relationship.
Yeah.
And most especially, according to your ways, let the guys, since we are talking about
men for today,
try as much as possible to stick to one partner. So that yeah, if baby, now we have these complications. So what I said. Then what we do is use protection. The protective sex is what we always advocate. Because we know home talk. Make sure that Charlie feelings the whole, but Charlie protect yourself.
Yeah.
Because you're already bad and one better than you. So protect yourself. And what I will always say is make sure that you test regularly. What am I test? What am I test? What am I test? Because especially in men, it's my inch. It's my inch. But did you not be inside areas? Because one of the signs is like I say everybody so we say answer at the day it is a cause harm. Oh what that? Answer na
this is what I've done.
In so bad. Say so bad and I say baby so what is so neighbor. I say who just na ya you say baby akọ so what na just na ya harm. So let's try so what man wa test me what person be test. I mean, prevention is better than cure.
Yeah,
you
sure.
know, prevention is easier and cheaper than cure. So now we have moved from the word prevention is better. It's better, but we have moved to the next word they can say prevention is cheaper
than
cure.
Sure.
So these are the three things that my advocates say you should protect it, at least make sure somebody protects your home.
Condom is not expensive.
Condom is the cheapest.
It's one of oh God.
There's someone also per skin actually. You know, you want to fool the skin.
No, I didn't.
Then stay to one partner and do regular tests.
Thank you. In fact, I am really impressed and sad today. And see, we've all heard what doctor said. Doctor ni edu nkomo bebre. Enti me nuanom be ma no I will urge you guys wo be hwe mo ho so yie amayen because mu ni ho a yen ni ho. E na yen so yen ni ho a mu ni ho. But bibia mu no emema no mu ye mema. Enti mesra mo se mo hwe mo ho so yie because ene dia mete ye die ama me ra ho pa ama me mood kra asesa me mood asesa. Enti mesra mo uma yen hwe ye ho yie na yen stick it to one partner and be ma no ade no won't be in there 24 hours oh just some few minutes and then you are done. So you can't even always have it on your woman. Sometimes you just be there. And that way, now to me, and see, won't stick it to one partner. Even saves money. It saves you with and a condom is really cheap. Condom, really cheap. And see, we should try say yebenya condoms near there. Thank you very much for watching us today. But yeah, I'm enjoy your sponsors for your sister. Open blog, papa. Blogger edimwa. Me say blogger anointing na ashemuma. And she baby out when you share Eden Blog Factory. Ubenya blogs a edimu number ubetimi afresh open blogger 0535 961 807 and I said 0243 964 264. And as a patarian so edimu quality. When we talk about quality, I mean quality. And share baby share Fly Trends collection. November Ontario edimu anu bonso esan da form say open a number na wa friend now betimi a friend 0278 964820 0278 964820 Obama Ontario eye kama. Madam Master say munya bre na mo de hwen yen ye be hia biom ɛwɔ ha yi a bye bye.